using the last graphic, and Diane's going to show the snow list right at the end.
Good afternoon, Lincoln, and thank you, Margie Prop, for making your way through the snow here today to provide interpretation. And I hope all of you are viewing this briefing from somewhere safe and warm. I just saw a statistic that we're on track to have the snowiest day on record in the city since 2009. And our dedicated city snow crews have been hard at work since late last night to keep the roads clear. I want to give them a big thank you for all of their hard work and ask for all of you to please respect the plow and make your passage safely past them when you're out and about, if you are. As of 1 p.m., Lincoln is under an official snow emergency, and residents are reminded not to park along arterial streets, bus routes, and emergency snow routes while those plows do their work. Liz Elliott, Director of Lincoln Transportation and Utilities, will join us at the end of this COVID-19 briefing with an update on our street conditions. Many activities for this evening and tonight are being canceled or postponed. Our libraries are closing at 4 p.m. today, and our rec centers are also closing early. So if you have plans to go out tonight, please check if those plans have changed. If you do go out, please drive carefully. Today marks another big milestone, our last media briefing of 2020 and our 99th pandemic-related news conference. And while we close the chapter on what we all agree was a challenging year, there is so much to be hopeful for in the new year. As a community, we're making encouraging progress on reducing the number of COVID-19 cases and relieving the pressure on our healthcare system and our heroes who are continuing to fight for the ill and the vulnerable. Our local directed health measures have resulted in measurable improvements that have supported Lincoln and Lancaster County's progress, and we thank all of you for being a part of those successes. Life-saving vaccinations currently underway also will help us defeat the virus, and our health department is hard at work quickly and safely distributing the vaccine, and we thank all those in our community who are a part of this vaccination effort. Health Director Pat Lopez will join us to share a more detailed vaccine update shortly. And while all of this progress gives us immense cause to celebrate, I want to encourage all of you to stay strong over the next few weeks and months, but especially with the upcoming New Year's holiday, and continue to practice those 3 W's and 3 C's. The risk of the virus spreading remains very high in Lincoln and Lancaster County, especially when people gather and let down their guard. By remaining faithful in our efforts to protect one another, by wearing masks, washing our hands, watching our distance, and foregoing gatherings, we can further reduce the spread of the virus, which in turn will accelerate our community's progress in defeating it. And while we are grateful for the progress we have made together, we do want you to be aware of some key concerns. We continue to see a decrease in the number of people getting tested, and our community's positivity rate remains very high. We're also keeping a close eye on a recent uptick in Lancaster County hospitalizations. These are among the factors that are keeping the COVID-19 risk dial in red for the 8th week. Our health director is here now with more to share about our indicators and more information regarding the vaccine.
Thank you, Mayor. I'll start today with an update on the vaccine. This is a major step forward in preventing illness, saving lives, and protecting our community. You will recall that the first doses of the Pfizer vaccine arrived in Lincoln on December 15th, and so far we've received 3,900 doses of that vaccine. We received our first 4,900 doses of Moderna vaccine December 22nd, and we are scheduled to receive another 1,100 doses later this week. Having a second safe and effective vaccine will allow us to vaccinate more people who are part of our initial phase. Both are 2-dose vaccines, and the second dose must be the same brand as the first. Vaccine supply continues to be limited, and we continue to vaccinate those in phase 1A. That includes healthcare personnel providing care and treatment to COVID-19 patients, as well as emergency medical technicians and residents and staff of long-term care facilities. Hospitals are vaccinating the healthcare providers, and our health department has vaccinated more than 300 EMTs in Lincoln and Lancaster County. Starting this week, some long-term care facilities, actually 5 have already started, vaccinating both staff and residents through a program that partners the facilities with participating pharmacies, which coordinate on-site vaccination efforts. Vaccinating these vulnerable residents and the staff who care for them is a critical step in providing additional protection to those who are at most risk of illness and death from COVID-19. Also, starting in the near future, vaccinations will be available for others who are in Phase 1A, including home health and hospice care providers, as well as school nurses. The number of doses we receive is dependent on the supply available from manufacturers and the amount of vaccine the federal government allocates to Nebraska. While the vaccine is not yet available to the general public, we are working with community partners on potential locations for public vaccination once the COVID-19 vaccine is more widely available. Multiple sites are being considered for the clinics, but no final decisions have been made. We will continue to share more information as it becomes available. Vaccinating Lancaster County residents will take some time, so we ask for your patience. In the meantime, please keep protecting yourself, your loved ones, and your community by wearing masks, watching your distance, washing your hands, and avoiding crowded places, close contact, and confined spaces. I really want to thank our health system providers, both CHI St. Elizabeth, Bryan, and Lincoln Surgical Hospital, as well as the Medical Society, who are doing a tremendous job of helping us get our primary care providers all vaccinated, all primary care providers in our community. And I want to thank you again, who are doing all the right things. Because of your efforts, several of the indicators we use to evaluate risks are headed in the right direction. However, many remain in the red area of our COVID-19 risk dial. After peaking at more than 2,100 new cases in the week ending December 5th, the number of weekly cases has steadily decreased. For the week ending December 26th, we saw 927 cases, a 56% decrease from the all-time high. The 7-day rolling average chart shows that steady decrease in daily cases from 287 cases on December 7th to 132 on Sunday. This is the lowest daily average since the end of October, just prior to when we moved into red on the risk dial. Testing capacity remains very high. Access to testing is widely available in Lincoln with most providers and clinics offering testing. In addition, Test Nebraska has expanded to have 1,500 test slots available per day. However, we are seeing declines in the number of people getting tested here in Lincoln and across the state. When you compare the first 2 weeks of December to the last 2 weeks, the number of people having tested dropped over 60%. While the reasons for the decrease in testing are not fully understood, our local hospital officials are telling us fewer people are visiting emergency departments and urgent care clinics with COVID-related symptoms. We also know that people are busier during the holiday season, and with universities and colleges on winter break, fewer students are seeking tests as well. With the average number of daily cases declining, the caseload for our contact tracers has declined as well, which helps initiate the contact tracing even sooner. This is important. This improvement in contact tracing helps to prevent further spread by more quickly identifying who needs to be quarantined due to potential exposure to someone who is COVID positive. Over the past 2 weeks, 100% of case investigations were completed within 2 days of the health department receiving a positive test. This week positivity rate for the week ending December 26 is 25.8. That is the lowest rate since the week ending November 7th, but it is still very high. Lincoln Hospital capacity has been improving prior to Christmas. The number of COVID-19 patients declined from a peak high of 177 on November 29th down to 83 patients on December 24th. Since then, however, we have seen a reverse. COVID-19 hospitalizations are back up to 101 today, with 58 patients from Lancaster County and 43 from other nearby communities. You can see the uptick in the hospitalization at the far right of this chart. The orange line represents the 7-day rolling average of new cases, and the blue line represents the 7-day rolling average of local hospitalizations. Both have been falling for nearly 3 weeks. Local hospital officials have been sounding optimistic about the situation, but they are concerned about the increased hospitalization numbers reported today. Hospitals are still moving forward with caution, and they continue to postpone some elective surgeries to maintain capacity. However, this recent decline in cases and hospitalizations across the state has provided some reprieve for healthcare workers at local hospitals. The arrival of the Pfizer and Moderna vaccines is also a very hopeful sign for our healthcare professionals who have worked so hard at great risk to care for patients. The pandemic continues to claim valued members of our community, relatives, friends, and neighbors. In December, we have lost 71 Lancaster County residents to COVID. This is nearly half of the 150 local COVID-19 deaths we have experienced. We extend our deepest condolences to those family and friends who have lost their loved ones to this virus. Sadly, many of these deaths were individuals in long-term care facilities. We are fortunate enough to keep the virus out of these facilities for many months, but with the virus being so widespread in the community, it's found its way into many facilities, even with strict protocols. We did see an increase in cases being reported in these facilities at the end of November and into early December. With the total number of COVID-19 deaths from long-term care facilities at 50, 1/3 of the total 150 deaths in our community. The color gradient map shows how our local metrics are averaged to determine the position of the risk dial, and it shows how we are very close to moving from red back to orange. We still have no metrics in green. Our testing turnaround time has improved into the yellow. Connected cases, contact tracing, and ICU availability continue to move toward the orange section. The remaining metrics are still in red, but they too have been moving closer to orange. You will find the location of the risk dial represented by the blue square outlined in red on the right. It is the orange and red transition area. It's on the orange and red transition area and on the verge of moving into orange. The arrival of the vaccine is giving us all hope, but the risk of the virus spreading is still very high. It is so important now that we all remain diligent in taking steps to protect ourselves and our community. Your efforts are making a difference, and we have data to support that. Before I turn this over to the mayor today, we want to share some interesting information on how our situation locally compares to the rest of the state. Every county in Nebraska is covered by one of the local health departments in the state. Many are multi-county and a few serve a single community, like our city county health department. Throughout the pandemic, the health departments have worked in their own communities and with each other to help prevent the spread of the virus. We have seen some similarities in how the local health departments have responded, as well as some differences based on the situation in their area and the needs of their communities. We all have had to make tough decisions to try to do what is best for our entire community. We have had many cases and lost too many of our residents, but our directed health measures have made a difference based on the data we are seeing. We're going to look at a comparison. First, we look at the fatality rate, how many deaths we've seen for every 1,000 COVID-19 cases. Secondly, we will look at the case rate, how many cases we've seen for every 1,000 residents. In this chart, we are looking at the fatality rate across all of the public health districts in the state at the end of last week, December 26th. The top bar in red represents the fatality rate for the state, which is at 9.6 deaths per 1,000. As you look at the rates for all the local health departments, you will see that Lancaster County, the bar in blue, has the second lowest fatality rate in the state at 6.6 deaths per 1,000 cases. As of today, we have lost 150 local residents, as I mentioned, to COVID-19. If we had a fatality rate of 9 deaths per 1,000 cases like Douglas County has, we would have 195 deaths. If we had a fatality rate of 15.8 deaths per 1,000 like Hall County, we would have lost 350 members of our community, about 200 more than what we have experienced. This chart looks at the case rate, the number of cases per 100,000 population. For the 5 most populated counties in the state case rate is represented by the red bar on the right. The left column in blue represents Lancaster County, which has the lowest case rate of the counties at 6,895 cases per 100,000. As of today, Lancaster County has had 22,236 confirmed cases of COVID-19 since the pandemic began. If we had the same case rate at Douglas County at 9,000 cases per 1,000 population, we would have had an additional 6,300 cases. If we had the same case rate as Hall County at 9,495 cases per 100,000 population, we would have had an additional 8,300 cases. We recognize that there are many factors that can impact the rate statewide, but this data shows that we have made a difference by your individual and collective actions. The stronger directed health measures, business compliance with protocols, a mask mandate, and the commitment of our community members to do their part to protect one another. We understand that the directed health measures, the restrictions, and the protocols have required a great deal of sacrifice by many. Your efforts are preventing more illness and death in our community, and I thank you.
Thank you, Director Lopez, and I share your gratitude for our community and the remarkable efforts everyone has made to defeat and continue this fight against the virus. We, of course, are looking to celebrate the end of 2020 and ring in a new year full of promise and the potential to end this pandemic. And as we think about all of that, please remember that the safest way to celebrate the end of 2020 is at home with the people you love and live with, or virtually with friends and family. And as I mentioned at the beginning of this briefing, Liz Elliott is here from LTU to update us on snow operations. But before we go to Liz, let's first take questions from you all on COVID-19. So opening it up to questions from the media.
This is Bailey. Oh,
Bailey.
hi, with 1011. I am just wondering, with, many of those numbers are pretty optimistic with our case numbers overall going down, having a lower average, and just looking at the comparisons between Lancaster County and other counties, what would you say to people to encourage them to stay vigilant, to keep those numbers down, and to just proceed with caution this holiday weekend?
Thanks for the question, Bailey. Well, I said once early in the pandemic that a lot of this is going to come down to the choices that we make. And I think what the data shows and what is encouraging is that people in Lincoln and Lancaster County are making the smart choices. And when they make smart choices, we get better results. The people of Lincoln and Lancaster County are helping to turn things around in our community. And if they continue to make great choices, and if they can make great choices on New Year's Eve, we hope to continue our progress. There is hope on the horizon with the promise of these vaccines. We are so fortunate to have a scientific community and the investments of our federal government that have made a vaccination possible in warp speed. It would be a shame to see case numbers go up, to see a reversal of our progress when we are so close to the time when more people can get vaccinated and when we can put this pandemic behind us. So let's just stay strong. Let's stay focused on caring for one another and protecting one another by continuing to practice sound public health strategies until that day when everyone has had a chance to roll up their sleeve and get the vaccination. that would be my message to the public.
Hi, Mayor. It's Matt Olberding with the Journal-Star.
Hi, Matt.
Hi. Either you or Pat, do you have any more information about the vaccinations that are going on at long-term care centers?
Health Director Lopez will be right out.
Hi, Matt. I can tell you we have 5 long-term care centers that started on Monday through, the federal government partnered and directly contracted with some pharmacies such as CVS, Walgreens, and we have some other community cares and long-term care pharmacies in Lancaster County. And most of our assisted living and long-term cares have made an arrangement with them to provide the vaccine directly. So on Monday, they started at some of the facilities, and next week we'll have a broader update. But there are some still in process, and we're working, but our local community pharmacies have done a tremendous job of already reaching out to some of our larger long-term cares and getting that process started. We at the health department will be working with a few smaller assisted livings and getting vaccine out to them and their staff next week. So we're really excited. We're excited for the staff, the residents, and for the families of those residents, and looking to a really bright future for them to be able to see one another again.
Do you have any estimates on numbers, like how many residents and staff will get vaccinated this week, or?
Matt could give you a better idea next week when we do the briefing Tuesday, because we've just started. I could look at what's been done already this week and send you an update, because most were just starting Monday, and then 2 of the other places were being done today. So I don't have, today being Tuesday, I don't have the full numbers yet.
Do you have names of the facilities that are starting this week, or is that not something you're?
I probably would not want to release that yet without talking to them.
Okay, thanks.
Uh-huh.
This is Bailey with 1011 again. Along those same lines, on long-term care facilities, a large majority of the state's deaths have been in those facilities. What would you hope the impact of getting the vaccine to those people will be?
Well, we know that in Lancaster County, we have seen fewer deaths actually. And the majority of the deaths that we've had in long-term care facilities have just been this past December. I had mentioned we had an outbreak at the largest long-term care facility in the state here in Lincoln, and they've been really working on that. What we do know is how the virus gets into the facilities is from the staff and others coming inside. So we're extremely excited to see that the staff is going to be vaccinated now, and those opportunities for the virus to come in, as well as the residents being vaccinated, is going to make a tremendous difference. It's because everyone knows that individuals in the long-term care facilities, those residents are very vulnerable. Many have chronic health conditions or other more serious situations, and so their immune system isn't able to ward off the vaccine virus and to heal well. Our goal is to see that all of the long-term cares we hope will be vaccinated in the next 3 weeks.
Along those same lines, Pat, do you happen to know, are they prioritizing one group or the other? Or are residents getting it first, staff getting it first, a mix of both? Or?
Well, Matt, the facilities I've talked to, everybody's getting it at the same time. So the residents and the staff are all getting it. And the staff are very anxious to get the vaccine as well, and the residents. And the vaccine in the community, the doses we have had on hand should be all distributed out into our primary care physicians and those areas by early next Tuesday. Just a little update on that as well. We're already starting, it seems unbelievable, but on the Pfizer vaccine, we'll be giving the second dose to many of our EMTs and our primary physicians that were in the first round next week. So those are all bright stars in our future here.
This is Bailey again. you talked about just the comparison of numbers between the county, Lancaster County, and other counties. The leadership in Lancaster County has received a lot of feedback, not all positive, about some of the directed health measures, specifically mask mandate, businesses being closed. Do these numbers that you're seeing now kind of make it worth it, make it easier to see through all of the controversy it's caused?
Well, I think, one thing I would like to say to Bailey is I think sometimes we hear about some of the controversy that goes on with any decision. All things aren't going to make everyone happy at any one time, but we use the scientific information we had and all the information that was happening both nationally and in our state, and looked at all those measures from a public health and epidemiological perspective. And so even though it was very difficult, we felt we were making the right decisions for our community to protect them. And I think that data helps show that. And I also want to say that I received contact from hundreds of people offering support and support to our staff, and a feeling of being really safe in our community because of the measures that we've taken. And I frequently hear that from other parts of the state as well.
Any other questions related to the pandemic? Okay, if not, then we will now hear from our Lincoln Transportation and Utilities Director, Elizabeth Elliott, with the latest information on snow operations.
Thank you, Mayor. Lincoln Transportation Utilities declared a snow emergency for the city of Lincoln at 1 p.m. today. This means that parking is banned on both sides of emergency snow routes, bus routes, and other major arterial streets. Residential parking bans are not in effect at this time. You can find the latest information on city snow operations at snow.lincoln.ne.gov. Currently, LTU has 85 city and contractor crews out on the streets with plans to plow late into this evening. Residents are asked to kindly refrain from parking on the streets to give plows as much room as possible. Depending on snow accumulation, multiple passes may be required. We will continue to evaluate if this is necessary as the storm continues. This winter season, we implemented a change in how the city manages residential street plowing with a new test to deploy contractor crews in residential areas that need plowed, while the city crews focus on arterial streets. Today is the first time we've needed to deploy this test during a storm, with 6 companies operating 31 units. At 8 a.m., residential contractors were activated to begin operations by 9 a.m. This allowed snow plowing efforts to begin up to 15 hours earlier than compared to operations in the past. We expect plowing of residential areas to be complete about 12 hours after commencement of operations, and we'll review how operations went at that time. As the storm progresses, our snow fighters will continue to clear snow and ice on arterial streets, possibly up to midnight tonight. We will continue to monitor the streets, weather forecasts, and street data to determine if we need the contractors to go back through the neighborhoods for a second curb-to-curb pass. Our plowing operations are prepared to move into de-icing operations if the snow turns to sleet or ice. We will keep everyone updated if this happens. Again, you will always find the latest information on city snow operations at snow.lincoln.ne.gov. Thank you.
Finally, as we close out this briefing, I want to say thank you to you and the snow crews. Thank you, Director Elliott. We are so grateful for how hard you are working to keep us safe in a different realm. And again, ask everyone to please give our snow fighters the space to do their jobs. And if you do go out, please, please drive carefully and be mindful of the conditions. Finally, one more reminder to be safe as we ring in the new year, a year that we hope will be filled with health and much happiness. When you hear Auld Lang Syne played on New Year's Eve, I hope you'll look back on this year, while probably not fondly, at least with admiration and appreciation for the way people across our community and across the globe found new ways to be there for one another. Let's raise a cup of kindness for all of those who have made an effort to protect one another, and let's look forward to what the future holds. Thank you. And with that, we'll open it up to any questions, any further questions about our operations.
Hi, Mayor. It's Matt Olberding with the Journal-Star again. I just wanted to ask Liz possibly if she's had any feedback today on how the residential plowing has gone so far.
Hi, Matt. Our crews out on the street think that it is going pretty well. It is the first time, so it is. We definitely have a learning curve that we are all working through, and things are probably going a little slower than we had hoped. But I think once the contractors and our crews get familiar with the areas that they are doing and how we are working them, it'll start going much faster, both today and in the future. We haven't heard from the community a whole lot of complaints, so I think no news is good news, and we hope it continues that way throughout the evening. So thanks.
And just one quick follow-up for you. If I understood you earlier, time frame wise, it sounded like you expected the residential plowing portion to be done sometime tonight.
We expect that the contractors will have them plowed within about 12 hours based on our experience and also the experience looking at Omaha, who has a similar program. It takes about 12 hours to complete the plowing in each of the areas that the contractors have. So we're estimating 12 hours. Everything should have at least one pass through.
Great, thank you.
Any further questions? All right, thank you so much for tuning in, and we wish you a very safe and happy New Year's Eve, and we are looking forward to ringing in 2021 with you. Thank you.